What does an oncologist see on a stomach cancer CORT scan? When a doctor looks at a CORT scan for stomach cancer, they are searching for specific clues that tell them if cancer is present and how far it has spread. The scan provides detailed images of the stomach and surrounding tissues, helping to guide diagnosis and treatment. One of the first things they notice is the size and shape of the stomach wall. Normal stomach wall thickness is about 2 to 3 millimeters in the body and 5 to 7 millimeters in the lower part called the antrum. If the wall appears thicker, especially if it is irregular or uneven, it can be a sign of cancer. Tumors often show up as focal or widespread thickening that exceeds these normal measurements. After contrast dye is injected, cancerous areas tend to enhance strongly, appearing brighter on the scan because they have increased blood supply. Ulcers or crater-like defects on the surface of the stomach may also be visible, especially in more advanced cases. The next thing an oncologist looks for is disruption of the normal layers of the stomach wall. The stomach wall normally shows a layered pattern on the scan, representing the mucosa, submucosa, muscular layer, and outer serosa. When cancer develops, it can break through these layers. Early tumors might cause some thickening and enhancement without fully destroying the layers, but more advanced tumors often invade through the entire wall, obliterating the normal pattern. If the outermost layer, called the serosa, appears abnormal or shows high-density areas, it suggests the tumor has penetrated through the stomach wall, which is important for staging the cancer. The scan also helps identify if the cancer has spread locally into nearby tissues. This shows up as infiltration into the fat around the stomach, which appears as streaky or hazy areas with indistinct margins. Such fat infiltration indicates the tumor is invading beyond the stomach, meaning a more advanced stage. Enlarged lymph nodes are another key feature. Nodes larger than 1 centimeter in short axis diameter are suspicious for cancer spread. They look like rounded, dense structures near the stomach and help determine how far the cancer has spread. Distant metastases are also checked on the CORT scan. The liver is the most common site for stomach cancer to spread. Metastatic lesions in the liver appear as distinct, often round or irregular dark spots that stand out from the normal tissue. Detecting these is crucial because it influences whether surgery is an option or if systemic treatments are needed. Some types of stomach cancer, like mucinous carcinoma, have unique features on CORT. These tumors may show large areas of low attenuation, meaning they look darker due to mucin pools inside the tumor, which can help differentiate them from other types. In addition to diagnosis, CORT scans are useful for guiding biopsies. If a suspicious lesion or lymph node looks abnormal, the scan can help direct a needle to obtain tissue samples without needing surgery. Overall, an oncologist uses the detailed images from a CORT scan to assess the size and location of the tumor, how deeply it invades the stomach wall, whether it has spread to lymph nodes or other organs, and if there are distant metastases. These findings help determine the stage of the cancer, guide treatment decisions, and predict outcomes. Remember, each case is unique, so always consult with healthcare professionals for personalized advice.